40% of children who were born to teenage mothers did have very severe outcomes. For instance, many of them had stunted growth because the mothers didn't know how to feed them. And then you had these teenage mothers who also were going through a lot psychosocially, processing what it is like to have a child at such a young age.
Hey, I'm Hannah. Welcome to What's in the World, the podcast for all your news, trends and talking points from the BBC World Service. In Rwanda, politicians are calling teen pregnancies a national crisis. The Ministry of Health says that nearly 40% of babies born to teenage girls are unplanned. So now it's passed a new law that gives teenagers who are 15 or over access to contraceptives without their parents' consent. So could that be a solution? Well, it has got mixed reactions in Rwanda, and we're going to break those down today with Dorcas Wangira, the BBC's Africa health correspondent in Nairobi. Hi, Dorcas. Welcome back to the podcast.
Hi, Hannah.
So let's talk about this new law. What does it mean for teenagers in Rwanda?
Well, so this means that teenagers aged from as below as 15 to the age of 18, they can access contraceptives and also sexual reproductive health, even without the consent of their parents. But what is important to note that it is medical consent. It means that they can go to a healthcare center and get information about pregnancy, and also if they would wish to access contraceptives before pregnancy. It also includes care such as mental health support, particularly for adolescents who got pregnant either out of abuse or out of rape, which was not available before. So before, only teenagers aged 18 and up could get this kind of care, but now even without your parent, you can access this care.
And what was it like then for people who were under 18 when it comes to sexual education or contraceptives? What could they do before this law was introduced?
Well, so Rwanda, just like many other African societies, many parents do not have conversations about sexual health with their children. I mean, if a child wanted to learn more about their body, if they wanted to learn about sex, it wasn't possible. And most likely, the healthcare center would be the next best place to learn if it was not in school. So what was being seen in Rwanda was that the rate of teenage pregnancy was very high, particularly in settings which were of poverty, and also where you saw the context where there was abuse. You had situations where teenagers were having sex with themselves, sex amongst teenagers, but also what was concerning was the teenage pregnancy. So lawmakers did meet to discuss what would be a solution. In 2022 particularly, this was a conversation. This bill was not passed into law, but now 3 years later, we are seeing this legislation allowing teenagers. But what is important is that the medical consent is still there. It doesn't mean that you can just go and have contraceptives if you want. A doctor or a healthcare professional would have to prescribe it and would have to prescribe the right contraceptive that you would need.
And the teenage pregnancy issue in Rwanda, as I mentioned, politicians were calling it a national crisis. Just how big of a problem was it?
Well, so Rwanda is a relatively small country compared to other East African countries like Kenya or Tanzania. But when you have more than 20,000 pregnancies in 1 year, because of the population, the rate becomes much high. So this is a concern. It was called a crisis. But also just to underscore that some of these teenagers, a huge percentage, also had gone through abuse. And many of these pregnancies were unplanned or unintended. But also what was a concern besides just the sheer numbers? You can imagine what is it like for a teenager to be a parent. The Ministry of Health did observe that 40% of children who are born to teenage mothers did have very severe outcomes. For instance, many of them had stunted growth because the mothers didn't know how to feed them. And then you had these teenage mothers who also were going through a lot psychosocially, processing what it is like to have a child at such a young age. So it's not just the sheer numbers, but also what were those children like, those ones who are being raised by teenage mothers. So it is a ripple effect. It doesn't just affect the mother, but also the children who are born. And that is why it was being called a crisis.
And how does this compare to neighbouring countries? Do they have similar issues?
Well, so teenage pregnancy is a concern. It's not new across Africa, and particularly amongst adolescents in neighboring Kenya, in neighboring Uganda, even in Tanzania. We have adolescents who were getting pregnant at that young age. But what is a bit baffling is that, one, in an age of information such as the one we live in now in the 2000s, 2010s, you expect younger people to have this information. You expect them to know about contraceptives, whether it's the pills, the long-lasting ones or the short-acting ones. But then this is also a concern because we have seen with the dismantling of USAID, a lot of these services are not available. The United States Agency for International Development, or USAID, was set up in the early 1960s to administer humanitarian aid programs on behalf of the US government. But President Trump shut it down earlier this year, greatly impacting things like sexual health and education programs in Africa and indeed Rwanda. There was a project by USAID known as DREAMS, which was specifically for adolescents. And this one was initially helped to stem HIV new infections. So teenagers would be given activities to do. Some would be taken through school. If you came from a background where you were likely to get pregnant at an early age because of the setting, because of crime and insecurity, there were programs to help younger people. But now we are seeing a drawback in this. So it is becoming a concern again. But what is concerning is how much are governments prepared to handle this problem, whether through law or providing services for teenagers, and also ensuring that these conversations are being had. What we've seen over the years is that there's been a lack of consensus on whether to introduce sex education in schools. Some people argue that it would make teenagers more promiscuous, so to speak, but then it is the knowledge that is needed so that teenagers can be more informed about their choices and they can know what to do in the event that they're likely to get into a sexual relationship.
I was going to ask, why is it that teenagers don't know how to prevent pregnancies? But you said there's no sex education in schools.
Well, yes, what is called comprehensive sex education is still a very, very big debate. You know, many societies are very conservative, particularly where you have religious voices speaking. Like in Rwanda, their very first cardinal spoke out against this law. And not everyone supports it. You know, when people think of sex education, they just think of sex and people getting pregnant, giving teenagers a license to have sex. One of the teenagers we spoke to in Rwanda did say that teenagers are having sex whether you like it or not, but understanding your body. What does your body look like? What is your menstrual flow like? You know, how do you react to certain things? And also when you talk about contraceptives, there are so many methods. There are condoms, you have the pills, you have even more permanent methods, you know, but the pushback is also with the conservative beliefs, we're just not having these conversations, Hannah.
So you have been speaking to some young people in Rwanda, Dorcas. How do they feel about this new law and the rights that it gives them to access contraception without their parents getting involved?
Well, so we have spoken to different people. We've spoken to young people and even older people. What is surprising is that there's really no general consensus. One of them is a teenage mom, and she says that this is very welcome.
Whether we accept it or not, adolescents are engaging in sex at an early age. Maybe the best option is to give them access to this information and services that can protect them. I had my baby when I was 17. I am now 18. Maybe if I had known about such options before, I would have known what to do.
I spoke to Dr. Christelle Giraheza, who is a medical doctor and also a sexual health educator.
I strongly support this law. I remember one day a 16-year-old girl came to me at the hospital, already 5 months pregnant. She was terrified, not only because she was pregnant, but because she knew her dreams of finishing high school might be gone forever. She whispered to me that she had wanted to use contraception but didn't know where to go without her parents finding out. She had been too afraid to ask. That pregnancy could have been prevented if she had access to education and confidential, youth-friendly services. The truth is, many teenagers are sexually active, whether by choice, by peer pressure, or in the worst cases, through abuse. Denying them access to contraceptive until they get parental consent is not protecting them, it's leaving them vulnerable.
Then we also spoken to people who have very, very strong opposing views. They're not for this law at all. And some of them are speaking out on social media. Not all of them are living in Rwanda, but they are not for younger people having this access to contraceptives without their parents.
My name is, first of all, Patrick. I'm a Rwandan American based in United States. Honestly, I don't support this. Telling young, very women or kids, for example, to begin swallowing the things like pills is it's like an indirect way of telling them to go ahead and then having a sex and encouraging immorality in the youth.
Now this has come in, this new law, do you think it will actually make it easier for young people to access contraceptives and reproductive services? Or is there also an issue with resources, especially in more rural areas that might not have such well-stocked medical centres?
That's a very important question, Hannah, because the law is one thing, the implementation is another. It is expected once President Paul Kagame assents this to law that it will be a government, it will have the stamp of the government, and that the government says this is okay. But then you're also looking at the availability of contraceptives. You're also looking at the healthcare facilities and also the people who are going to be assisting the younger people to access this. Remember, it's more about medical consent, particularly knowing what works well for a particular adolescent, what it is that they would want. The organization USAID, before it was dismantled, it had purchased contraceptives worth $9.7 million, which was intended for 5 African countries, including Kenya, Tanzania, even Mali. And what we do understand is that these contraceptives are in a warehouse in Belgium and they're due for incineration because they cannot be sold to another organization. The US government says that it believes that the contraceptives are to induce abortion, while some US leaders say this is not true. So we are looking at a situation where what are the priorities for each government? Is providing contraceptives for young people a priority? So once this becomes law, that is a good step, particularly because Rwanda has always been a model for other African countries. It may mean that other African countries can follow suit for this particular age group. But then you also have the elephant in the room is the availability, and also just people being open to have these conversations about sex education, being open to have young people going to healthcare centers, even without their parents, and not being judged. I remember growing up how difficult it was to even purchase some things over the counter. For instance, you'd see people go to a chemist or a pharmacy, and then you'd want to buy condoms. And it would take so long because, you're thinking, what will this person think about me? When you're talking about the pills, the contraceptive pills, when you go to get them, even in a healthcare facility, there's always this sense of judgment. Now think about it for a younger person, a teenager, and you'd have like nurses who are like, why are you coming to get pills? Or why are you being promiscuous? So the law is important, but we still have a long way to go.
So let's see what happens with this when it actually comes into practice and if it does become a bit of a trendsetter across the continent. Dorcas, thank you so much.
Thank you.
That's it from me. Go and check out some of our other episodes. Like, follow, share, subscribe. You can find us on YouTube 5 days a week. And 2 of those, we are right here chatting away in the studio with some of your favourite guests. I'm Hannah. This is What in the World from the BBC World Service. And we'll see you next time.